Hi, I'm Dr. Patrick Boyett with OrthoSports Athens. I want to talk to you a bit about personal fitness. We see a lot of patients who come into our office who are in their middle-age years, and they've decided, hey, I want to get in shape. And so one common place that we see this is patients contacting personal trainers, which can be a very safe and effective way to approach exercise. But oftentimes we see patients who go out and start an exercise regimen on their own, or they participate in a group type exercise program. Here in Athens we have a very popular group of exercise enthusiasts that go to Zumba. We have a boot camp program here, and then there of course are two very large gyms here in Athens where people can go and participate in activities such as this, as well as personal training. The one piece of advice that I would give you from an orthopedic surgery standpoint is you should transition from a sedentary lifestyle into a very active exercise lifestyle over a slower period of time than probably your brain wants you to. Because we all want to go to the gym and participate at a high level on day one. But that is just not practical given our bodies and given our age. I encourage my patients, especially those with arthritis, to avoid a lot of impact type exercises. We tell our knee arthritis patients that swimming is probably your best exercise as far as arthritis of the knees and hips. Bicycling is probably next, elliptical, followed by treadmill, with running being the most difficult on your joints. And the reason running is such a problem is when you're running, you're creating an impact on your knee as well as a distraction. So every time you take a step, the joint of the knee and the hip and the ankle, it's impacting that cartilage. And if you already have some underlying arthritis, which many of us do by the time we're 35 or 40 years old, it exacerbates those symptoms. So I would encourage you to exercise. It's an important part of our well-being and our health. It's good for you from a cardiovascular standpoint, from a diabetes standpoint. It's important for happy longevity, but it needs to be done with caution, and it needs to be done in a structured way. So I think a personal trainer or some type of formal exercise program, it's probably best if you consult with your primary care doctor about that. They can give you some guidelines as well about how to enter into a program, and maybe specifically finding a program that's good for you as a unique individual.